Good morning, everybody. I think we'll get started. I'm sure there will be others joining us in the next couple of minutes as well, but I will just start by going through housekeeping. So as usual, if you could please mute your lines and turn off your videos unless you're asking a question or until we get to the discussion bit. That will be helpful just in terms of the quality of the call. Please do raise your hands and let us know if you want to ask a question and give feedback. And happy to take questions and feedback throughout the webinar. Please obviously share your comments and feedback within the Teams chat function. It's helpful if you can add your name, role and organisation just so we know who's posting. And then also to remind you all that we are recording this webinar. So if there are any issues with that, if you could get in touch with me directly. Thank you very much. Next slide, please, Ryland. So thank you for joining us today for kind of an add-in webinar to look again at the maternal mental health services bid since the official guidance was published a couple of weeks ago and was sent out to you. So the idea of this webinar today is really just to go over the information. Much of it you've already heard, especially those of you who joined us on the webinar on the 15th of July. To clarify any information that has changed in the latest version of the bid paperwork and the guidance that goes with it, and also really just for you to have an opportunity to ask questions and have some discussion as a wider group about the bids that are going to be proposed. Can I just ask you to put yourselves on mute and switch your video off unless you're asking a question? Thank you. And really, this slide set, we won't go through all the detail in it. A lot of this is really to be used as a resource pack for yourselves when you're going back and through the process of writing the bids. Hopefully there will be useful information within this that you can come back to. So we will start off this morning with Jenny's going to just remind us again in terms of the national overview and why are we doing maternal mental health services. I'm going to then revisit the bid guidance notes. Again, as I said, clarify the information that you've previously had and some additional information. And then we're lucky enough this morning to be joined by Kate King-Hicks from Public Health England, and she's going to be talking to us about equalities and health inequalities and thinking about the information that you need to provide in terms of knowing your local population needs for your bid and what are some of the data and the tools to support you in developing your service and your bid. And then after that, we're going to have a discussion and question and answer session where hopefully we can just have some a good discussion about the bid process and any queries that you may have, but also that if there are any questions that you want us to take back to the national team to be answered on your behalf. Okay, so I'm going to hand it over to Jenny. And the next slide, please, Ryland.
Morning, everyone. As Liz said, a lot of the stuff that we're presenting this morning won't be new to you, but I think it's good to firstly have a recap now that the bid process is live. And secondly, you'll have all the slides in one place after the webinar, so you can use them as a resource pack. Next slide, please, Ryland. So I'm sure most of you on the call will be familiar with this one. So just as I say, a recap, this was when we were still calling them maternity outreach clinics rather than maternal mental health services. So the key points from this slide being that it's a joint maternity and mental health ambition. And the aim is to implement clinics that offer mental health assessment and intervention for women experiencing mental health difficulties directly arising from or related to the maternity experience. So as you can see, a broad ask and aiming to integrate maternity, reproductive health and psychological therapy. Okay, next slide, please. Some of the issues that these new services are trying to address are outlined in this slide here. I think the box on the right is probably the useful one to have a quick look at the moment. So such presentations may include, but are not necessarily limited to, PTSD following traumatic birth, PTSD following any pregnancy, perinatal or neonatal loss, terminations, miscarriage, stillbirth, neonatal death, child removal, and severe fear of childbirth. Okay, Ryland, next one, please. You would have seen this before, and this was just some of the ideas that I jotted down. Thing to think about is that this is not an exhaustive list, and you may well need to have a list that looks slightly dissimilar to this because of your local need. And that's fine if you can give a rationale within your bids as to why you've gone for a particular service, a particular intervention, because it relates to your local population, then that, you know, we would really look forward to receiving that. Next, please. So this is just to think about the disciplines that should be involved, and I think we all know now that they need to be multidisciplinary. So just having a think about, well, how will that work for us? Do we need a nurse prescriber, for example? How are we going to link in with our IAP services? Could we have a psychological wellbeing practitioner embedded in these clinics? What about the role for the peer support worker? Really important to think about third sector, because largely birth, trauma and bereavement has been a commissioning gap. There's a lot of third sector organisations that have sprung up and are addressing the gaps in commissioning in this area. And you need to know who they are and how they're going to fit into your pathway and how you're going to work together with them. So I think that's really, really important. And again, I think within the bids, we'll be looking for that sort of collaboration and how those pathways are going to be working. How you're going to advertise this new service and to make sure that the message is getting out to so-called hard to reach groups. Okay. Next slide, please, Ryland. This slide, I just found this on Twitter and really liked the image of the importance of that stakeholder consultation. And I know that the way that the bids have gone out now, you don't have a lot of time to do the stakeholder consultation that sort of pre-COVID you would have wanted to do before submitting a bid. And I think the message is, we get that, we really do get that, but it's important that you show that you've got a plan to consult, you've considered who all those stakeholders are, and you've got a plan to consult with them. And I just liked this because it was a sort of a baby image, so perinatal sort of linked, but also showing what can happen if you don't consult properly with the people on the receiving end of services. Okay, next slide, please. It's just a little bit more about stakeholders. And this is, again, my list, and yours may well have additional people within there. I don't think this is a comprehensive list. It's just a starter for 10. It's just something to get you thinking. And I'm sure that I haven't thought of everything within this. So hopefully that's a useful start. And I think that's the last of my slides. So I'm going to hand over to Liz, who's going to go into the bid process in a bit more detail.
Can I have the next slide, please? Oh, sorry.
Oh no!
Just a key message from Jenny. You've your most important message.
Yeah, and I forgot it. There we go. So this came down very recently from the national team that all teams are encouraged to bid in this current round, even if you're going to be a slower starter. And this is your opportunity to scope and develop a service with transformational funding before 23-24, which is an important date because that's when these services have to be provided. So rather than another sort of pressure because of everything that's been going on this year and what an unusual year we've had, just if you can try and reframe this as a marvellous opportunity to really do some of the hard digging, to scope this out using the transformational funding and to see what sort of model you'd like to be utilising by 23-24, I think, yeah, it's a really lovely opportunity. So sorry for forgetting my key message, and I think now I hand over to Liz.
You do. Thank you very much. Next slide, please, Roland. And the next slide again. So I'm just going to talk us through again the actual bid process and the paperwork. I'm not going to go into as much detail as we went into on the 15th of July. Those slides are still available, so if you haven't received them already, then let us know and we will, we'll send them out to you again. And the recording of that webinar is available on our website, and details of that are at the end of this slide set, so you'll get them again now. But as you will have seen from the emails that went out 2 weeks ago, there are now updated timescales in terms of the bid process. So the paperwork went out on the 31st of July, which was the launch call for proposals to be made aware of the transformation funding, and also the circulation of the proposed documentation and guidance. So there is a period during August and September in order for you to develop your proposals. It says for the STPs to develop the proposals, and obviously that is everybody working together on behalf of the STP to develop that proposal. So the expectation is that the proposals will be written by the specialist teams, but working with commissioners, working with maternity services, working with your service users, in order to pull that together. And I will go through in one of my later slides about who you need to get sign off from. So probably the most important date is the submission date. And the submission date for the proposals is Wednesday, the 23rd of September at 5 p.m. And we will be sending further reminders about that. But I think it's important to bear in mind that timescale. And as Jenny says, it's not that far away, but actually there's quite a bit that needs to be done, and especially if it needs to go and be signed off as well once completed prior to submission. Then what happens after you have submitted your bids? Well, there is then going to be a regional process of review of the expressions of interest, and I will give further details about that later in my presentation. But the regional panel is meeting on Thursday, the 8th of October, and that comprises of both the regional maternity team, the regional perinatal mental health team, the clinical networks, clinical leads, service users. I'm just trying to think if I've missed anybody. I hope I haven't. But so also those that have been involved with bids. So for children, young people's mental health from a LTP perspective, in order to give that perspective of the review of bids as well. So it will be quite a comprehensive process. We will then inform our outcomes to the national team, and then allocations will be confirmed and funding will begin to be released to the regions and then out to services. And then further funding will be released in 2021-22, pending on satisfactory implementation progress against your reports. Okay. Any questions quickly about the timescales? Or shall I move on and go through the process? Okay, I'm going to move on, but feel free to put stuff in the chat. Next slide, please, Ryland. So the main difference from the information I presented on the 15th of July is that there is obviously now one selection process to allocate all the transformation funding to both early and implementers and fast followers. So prior to COVID, the plan, as we know, was that early implementers would go first and put in their expressions of interest, and then that would be followed at a later date with fast followers. But because of timescales, both expressions are requested at this stage for that deadline in September. The transformation funding investment is to support service development, which will support women with moderate, severe, complex mental ill health relating to experience of loss or trauma in maternity, neonatal and perinatal contexts. And the bids must be in line with the parameters for the services outlined in section 1.3.3, which is in the guidance document that has been sent out both with this invite for this webinar, but also sent out separately to your services. And I will go through some of the detail of that in my slides coming forward. Okay, next slide, please. So, just to be clear, the expressions of interest are to be submitted on behalf of an STP, ICS or LMS area, but with a nominated lead CCG where the funding will flow to. So there are two elements, because we've had lots of questions about this, where services, and I'm going to use the example of Frimley for this. So Frimley is one LMS or ICS, but actually it has 3 specialist perinatal mental health providers for that LMS footprint. So it's expected that each SDP, ICS, LMS is eligible to submit one bid for their area, which could cover either part or the whole of the footprint. If the proposal is to cover only part of the LMS area, then they need to provide a rationale in terms of why that is the case, and also bearing in mind that all areas will need to access maternal mental health services by 2023-24. So I guess we would be promoting that services are working together to find a solution for the footprint of the LMS/ICS. But if that is not the case in terms of a bid, then it needs to be clearly articulated why that is not what is happening. Then secondly, if STP, ICS, LMS footprints want to work together, so wider than one footprint, in partnership with maybe 2 LMSs working together, then that's encouraged where it will strengthen the bid. But again, I think you would need to give information as to why that is the model you have chosen to do in terms of working together. There is a need for very senior management commitment to the sustainability of funding for the services by all CCGs, and this is a requirement in order for the release of the transformation funding. And when I come on to slides in a second with the sign off, it says that you have sign off and that you will that senior management will commit to the sustainability of funding the service going forward. The transformation funding is for revenue only, and all areas in receipt of the funding obviously commit to a programme of reporting and assurance to NHS England's an improvement both regionally and nationally. And for those services that have been through the Wave 1 and Wave 2 process for community specialist perinatal mental health teams, it will be a similar process. So reporting in terms of the number of additional women seen, your staffing levels of your service, etc. Next slide, please. Okay. So, as I said, some of these slides are quite busy, and this is because it will be a resource pack for you to go back to at a later stage. But I just wanted to include in here who is required in the sign-off of your bid. Now, these 2 columns are taken from the spreadsheet that you have received, which is the actual bid template. So it's about having your lead CCG who will accept the transformation funding. Also sign off from NHS England and the region. So that would be from ourselves as clinical network. So either myself and Jenny for Hampshire Thames Valley, or Anita for Kent, Surrey, Sussex. having provider trust and exec approval and signatory from those providers, so bearing in mind that that might take time to actually get the signatures. The clinical leads from maternity and mental health that are involved, exec approval with a name and signature for the lead CCG, also obviously confirmation as to whether you're an expression of interest for an early implementer or a fast follower. And then there's further details that is required in terms of the service sustainability, capital funding, partnership confirmation in terms of you working together, governance confirmation, and then the monitoring and development that you agree to be part of the monitoring and development for the national team. So I think it is important just to factor in that that may take quite some time to get those signatures, and so factor that into your timescales. Okay, next slide, please. So hopefully everybody is aware of their LMS ICS boundary, but this was just to highlight what they are in case anybody isn't sure. So we've got Bob, Hampshire, so the Ship, Patch, Hampshire and the Isle of Wight, Frimley, Surrey Heartlands, Sussex and East Surrey, and Kent and Medway. So those are the geographies which we are aware are not always coterminous with the boundaries of the specialist perinatal mental health services. So just to highlight that. Next slide, please. So what I have done is taken some of the key points from the guidance notes, the latest version that was sent to you on the 31st of July. So within the bid, applicants need to set out how their service will meet the cohort of women giving birth in the area with moderate, severe or complex mental ill health. As Jenny said previously, operate with a multidisciplinary skill mix, and detailing how the workforce, you know, either is competent and confident to fulfil that role, or how that will be obtained and supported via training. And there is the opportunity, obviously, currently with the transformation funding, to bid for additional money for the training and upskilling of staff to deliver these services. Supporting timely access to evidence-based specialist assessment and treatment in line with NICE guidance. Meeting the needs of the local population and building on learning from diverse co-production. And one of the key things that they have highlighted in this latest guidance, as opposed to the guidance that I presented on the 15th of July, is targeting health inequalities in the local area. And that's why we've asked Kate to come and speak to us today, to really focus on how you can look at that information and where you can get that data and tools to support you to develop that information. But the health inequalities is a really a big focus now going forward. Obviously demonstrating improvements in care for the women and families, and then also implementing a trauma-informed approach to care. Next slide, please. So successful sites will be required to submit implementation plans. They will have quarterly monitoring reports and participate in national activities that support shared learning and evaluation of sites. And in answer, I've just seen in the chat box that Vanessa's asking, and Jenny's kindly replied, yes, the expectation is that early implementers will begin mobilising immediately. You know, the national team are expecting them to be ready to go. Okay. Next slide, please. So in terms of the selection process, as I mentioned earlier, the process of selecting sites is going to be led by the regional mental health and maternity colleagues, with guidance and support from both the national perinatal mental health and maternity teams. The review panel is being held on Thursday, the 8th of October. The message from the national team is that given the delay due to COVID, that regions should be pragmatic in reviewing the expressions of interest and assuring that they meet the requirements sent out in this document. But as we've said previously at other webinars, you know, the national team and Jenny's key message was the national team want to support the development of these services and therefore want to enable the transformation funding to be used in the correct way. So it has to meet the requirements set out in the document, but the proposal is that if they do, then the transformation funding should flow. And that's slightly different to other situations where we've had, certainly in wave one, where it was a competitive process in terms of getting funding. This is not a competitive process. So the proposals will be assessed for outcomes in terms of clinical, patient needs and experience, safety, quality and sustainability, in terms of the resources, both staffing and training, etc. And then also the risks in terms of delivery of the service. And just to highlight yet again, really to emphasise, the selection process will include a particular focus on the health inequalities and co-production, and that's why we've chosen to put a large chunk of today looking at that health inequalities information, as Kate will give in her presentation. But also, and very importantly, as a second thing, ensuring input from people with lived experience. So please do take the opportunity to involve your maternity voices partnerships, your service users for the specialist perinatal mental health services. And even if COVID has got in the way and you may not have been able to do some of that scoping work to date, it's about building that scoping work into your bid process so it's really clear for the review panel to see that you intend to co-produce and take these services forward. Next slide, please. Okay, so detailed both within the bid template itself in terms of the spreadsheet, but also within the guidance document is a list of resources that they recommend to support your expressions of interest. So thinking about the mental health implementation plan, the mental health LTP analytical tool, which I've got a couple of slides that I'm going to come on to, advancing mental health equality, implementation of routine outcome measures in perinatal mental health services, the local joint strategic needs assessments in terms of giving data in terms of your population, also the embrace findings, the managing mental health and emotional well-being in maternity and neonatal settings, including responses to perinatal loss and birth trauma, and then also trauma-informed care. There is also a wealth of information on the NHS Collaborative Platform for Maternal Mental Health Services, and as you know, we regularly steer you to that platform for other resources, so do go and have a good look there, but there's a specific section on it for maternal mental health services. And also there is an example within the guidance document of an indicative workforce model, which I've got in one of my slides in a minute, and I'll come on to that. Thank you. Can I have the next slide, please? So this is obviously just highlighting the LTP online analytical tool, where you can work out the funding or the indicative proportions of money per STP or CCG level. Now, if I can go on to the next slide, please. So that's what it looks like on the platform. If I can go on to the next slide. So again, I appreciate you cannot see this because it's too small, but when it comes out in the resource, as slides coming out to you, you'll be able to look at the detail. What we have done is pulled off the indicative allocations for Dorset, Hampshire, Thames Valley and Kent, Surrey, Sussex, both as your STP ICS LMS area, but also as the CCGs. So you have a combined amount and also the individual amount. Now, the funding that is given through the analytical tool is the funding that will go into 2022-23 and 23-24. We do not have the exact figures for current, but what we would suggest and what the national team are recommending is you base your calculations on the figures that will go into the baseline going forward. What is important to remember, and is written in the note in the bottom, is that the allocations will be uplifted, and we're expecting that to be by 24% by maternity transformation funding. So you have your figure in the column and then you add 24% to it. We were expecting, as often happens in these situations, to have the final figures ready for this webinar, and we haven't received them. But if any figures come out and they are different, we will of course send them out to you immediately. But this is the latest information that we have and that is being pushed out nationally. Okay, next slide, please. So that gives the breakdown, that slide for Kent, Surrey, Sussex, again, of the different STP, ICS, LMS areas, and then the individual CCGs. And then obviously the figures in the kind of amber columns are the combined figures. Okay. As I said, I will leave you to go through the detail of them for your area when you get the slide pack. Next slide, please. Okay, as mentioned earlier, there is an indicative workforce model. This is provided in the guidance notes, and so just to highlight that, what they're recommending, and that's per 10,000 deliveries, so you can work out proportionally. Okay, next slide, please. So one difference that there is since I presented on the 15th of July is on the 15th of July, included in the actual bid template, the spreadsheet template, was this information, which has now been taken out and put as an appendix 2. And that's the information on existing service provision that successful sites will be required to provide. Now, my interpretation of this, which may be wrong, and I'm trying to seek clarity of this, is because it is asked for as additional information and not in terms of not included in the current bid template, is that if you are successful, you will then be asked for this information rather than necessarily needing to submit it for the 23rd of September submission. However, our advice, both regionally and from the clinical networks, would be to gather this information now, because you will be asked for it at some point. So it makes sense. I think it will be quite easy to collect. So it's about what is currently provided in terms of services and workforce. So, you know, please do look at this. It was presented, as I said, it was one of the tabs on the spreadsheet, but is now a separate appendix. So you may well have already started to populate this, but we would encourage you to do so. And we will seek clarification from the national team as to when the submission of this appendix is. Next slide, please. Okay, so before I move on to Kate, that was a bit of a whistle-stop tour, but hopefully a lot of the information is really recapping on information you've heard before or you've read through the information that we've sent out to you via email. Is there any questions that anybody wants to ask now? Otherwise, we'll pick them up in the discussion session after Kate's presentation. Okay, I will take the silence as a no. So I'm really pleased to invite Kate to speak to us today. As I say, there is very much a focus now on, sorry, I've just seen the question that's come through in terms of can we have the slides through faster. We will endeavour to, okay, we will endeavour to get them out sometime later today, if that's helpful for people. No problem. So the reason, as I said, that we've asked Kate to come and speak to us today is there's very much now a larger focus on the health inequalities and responding to your local population needs. And so we thought it'd be really helpful for Kate to come and talk to us about some of the data and tools that you can use to support the design of your maternal mental health services. So I'm going to hand over to Kate.
Okay, morning everybody. Thanks for welcoming me. It's lovely to be with you all. I am just going to give a quick overview of some of the data tools and resources to support in the design of perinatal mental health services. As Liz has said, taking account of health equity and health inequalities. So as you can see, I'm on the side here. So I'm actually going to turn my camera off if that's all right for everybody, because you're only going to be able to see the side of my head. So I hope that's okay. Can we move on to the next slide, please? Okay, so you'll probably be familiar with this paragraph. It's lifted directly from the site application guidance, and it's stating that expressions of interest must demonstrate a clear understanding of the needs of women and their families in their locality, and actively promote and consider equality and health inequalities, including reflecting on data from their own population and supporting the development of a robust response to health inequalities. Next slide, please. So where to start? So this is the front page of our Fingertips platform, Public Health England's Fingertip platform, if you're not already familiar. So in terms of reflecting on data from the local population, an easily accessible place to start is the mental health, dementia and neurology profile, and that's hosted on this platform. Next slide, please. And the themed profiles, including a perinatal mental health profile, are all part of our mental health and wellbeing JSNA toolkit. And you've moved on. Oh, can I move on again? Next slide, please. Thank you. So this is what the front page of the perinatal mental health profile looks like. And you can see the aims of the profile there. And the profile is broken down into demographics, risk and related factors, prevalence, and identification and access with services. You can see they're coming soon. So we're going to have a brief look at this now, and you can explore much further in your own time. So you can see there I've gone to start on the right hand side of the menu in terms of just how to navigate the tool. So next slide, please. And you can see here I've sorted the profile by demography, and we've got the overview there grouped by NHS region and broken down into clinical commissioning groups. And you can see the range of indicators that are available by CCG on the left-hand side there. So next slide, please. And here again, I've sorted by demography, but this time I'm looking at what's available at the NHS trust level. And you can see there on the left, it's presenting a different set of indicators for you to review. Should we go to the next slide, please? So this time I've moved on and I'm looking at the risk and related factors in relation to perinatal mental health. But instead of that kind of tiled overview you saw previously, I've chosen an area specific profile and looked at one specific CCG. And in this case, I'm looking at Medway. And you can see there's a spine chart on the right hand side, and it's showing whether the indicator that you're reviewing on the left hand side, so for instance mental health QOF prevalence, is whether it's higher, lower or similar to the England average. Should we have a look at the next one then please, Ryan, if we move on. So in this slide, I've looked at risk and related factors again, but this time I'm looking at the local authority level rather than the CCG. And you can see by looking at local authority, we can see there's a far longer list of indicators that we can review. And the next slide again, please. Next slide. Thank you. And again, this time I'm looking at risk and related factors, but this time by the acute trust. So here I've chosen Ashford and St Peter's, and you can see again another set of indicators that you can review there. So you're looking at all of these indicators at different geographies, different levels. Okay, next slide then, please. So, oh, sorry, come back. Actually, you can stay there, don't worry. So this is looking at prevalence. Now, these are really helpful. You've got some estimates of prevalence of mental health, perinatal mental health conditions there, you can see. But please take note of that sort of note I've got there on the left-hand side. So these estimates are national estimates of these conditions and using local delivery figures. And they've been rounded up to the nearest 5. So they don't take account of those important socio-economic factors or anything else that's likely to cause local variation. And also one of the important things to note is that you will not get an overall estimate of women with mental health condition by adding these estimates together, because some women will have more than one of these conditions, but it kind of gives you an idea here. And just that extra note there, it's believed that overall between 10 and 20% of women are affected by mental health problems at some point during their pregnancy or the first year after childbirth. Can we move on then, please? So that was a very, very quick look at the profile. And one of the very helpful things about the fingertips profile is their user guides to help you to support the tool. And this particular profile also includes a Public Health England report that you can download, which pulls a lot of that information together for you by either local authority area or CCG area. So do download those and have a look at those. Also within this tool, there's another piece of guidance there, which is actually part of the wider Joint Strategic Needs Assessment Toolkit. And it's primarily to support local areas developing their mental health and wellbeing content for their JSNAs. But you might find this is there's some really useful information in there and links and so on and so forth that you might find helpful. So just there's some resources there for you to use. Next slide, please. And this is just to kind of give you that overall context of where this profile sits. So it sits within the mental health and wellbeing JSNA toolkit. And you may also want to consider exploring that toolkit just to kind of get a sense of the wider picture as well. So that's there for you to use as well. And next slide, please. And then this is, I guess, just a reminder that this is a national mental health and wellbeing JSNA tool, and it supports with those nationally available inputs, the things that we can do once on behalf of everybody. But there are many, as I know you're aware, many other bespoke local inputs that should feed into understanding the needs of local populations. So it's just one part of this process. So if we can move on, please. So my colleagues in local knowledge and intelligence have also developed maternity health needs data packs for each of the local maternity systems across the Southeast. And these have already been shared with the LMS program managers. So if we could just move on again. And these packs present a selection of those nationally available data sources to support local maternity systems in undertaking their own health needs assessments. And they include a range of indicators, and they group together into those 7 areas. You can see their population, system overview, preconception and conception, antenatal care, birth, postnatal issues, and health issues. Next slide, please. So just to give you a sense, oh, sorry, next slide. Hello, can we move on? Thank you. Just to give you a sense of what some of these packs look like if you haven't seen them already. So this is some of the slides within the population domain. So it shows registered females aged 15 to 44, births, population, birth projections, births to Black and minority ethnic women, and to parents born outside of the UK. Can we have the next slide, please? And just a few more bits of information within that, again, that domain 1, we've got the percentage of deliveries to under 18s and over 35s, and we've also got fertility rates in there as well. Next slide, please. And also in this domain, we've got a really helpful map for each of the local maternity systems showing their levels of deprivation by quintile across the whole of that LMS. Obviously darker areas showing high levels of deprivation. So again, you should find those maps really helpful. And if we can move on again. This map actually isn't included in those packs. It's relatively new. It's been developed recently as a result of our work on COVID, but it has, as I understand it, been shared with STPs. And it shows the percentage of the BAME population by ward, and it's split by quintile, and it visually shows the spread of the BAME population across the Southeast. And as far as I'm aware, this map has only been created at that whole Southeast footprint, but you can see there the different LMSs outlined within that, STPs outlined within that. And this, of course, will be shared as well. Okay, could we move on, please? So there are many local resources for you to use, including perinatal mental health needs assessments that are hosted on Joint Strategic Needs Assessments websites. Now, I had a quick Google search when I was putting this presentation together. And for instance, I found Oxfordshire's mental health chapter as part of their JSNA had a section on perinatal mental health. And if you're fortunate enough to work in the Kent and Medway area, they've got a great observatory there, and they've got a separate perinatal mental health needs assessment that was pulled together back in 2016. So do have a look for those resources. Next slide, please. And again, sorry, there should be one more thing that comes in. There you go. So if you're not sure where to look, please do go and speak to your local public health team and their local analysts or analysts within the CCG, and I'm sure they can advise and support you with where to find those resources. Moving on, please. Next slide. And within this pack, again, I've just pulled together some other sources of data for you. I'm not going to go through those there, but these are also included in the maternity health needs data pack. So lots of resources to pull upon. Okay, next slide, please. So that's moving on from thinking about data sources to thinking about equity and health inequalities. So apologies if I'm repeating what you already know, but health inequalities are unjust differences in health and well-being between different groups of people, which are systematic and avoidable. So they exist across a range of dimensions or characteristics, including some of the 9 protected characteristics of the Equality Act, socio-economic position and geography, and they could be driven by different experience of the wider determinants of health or structural factors like housing, for instance, differences in health behaviours or other risk factors between groups, or health behaviours that may be influenced by wider determinants of health, like how much income you have, may be driven by unequal access to or experience of health and other services between social groups. And also, people who share protected characteristics may experience poor health outcomes as a direct result of discrimination or due to different experiences of the factors described above. So next slide, please. I wanted to include this slide because it was brought out in our recent report, Beyond the Data, Understanding the Impact of COVID-19 on BME Groups. And that report makes strong recommendations to focus on culturally competent services. And the same principle really applies to when transforming mental health services. So cultural competencies are the ability of providers and organisations to effectively deliver services that meet the social, faith, cultural and linguistic needs of service users. And it brings together being equitable and non-discriminatory in our practice and behaviour. It requires a balanced approach to others in which cultural identity and cultural context are taken into account. And like competence in general, cultural competence is the responsibility of both the individual and the organisation. And practice should be person-centred, non-discriminatory, accessible to all, and legally compliant. And services should reflect the lived experience of our local communities, their cultural identities, needs, and assets. So if we can move on to the next slide, please. Thank you. So I'm sure you're aware of both of these acts. So all our collective actions on equity and reducing health inequalities are underpinned by national legislation, the Health and Social Care Act, Duties on Health Inequalities, and also the Equality Act 2010, the Public Sector Equality Duty. Next slide, please. So again, thinking about equity and health inequalities, health equity assessment tools. Now, I think they're a really useful way to work through when developing or reviewing your overall programme or service provision by broadly asking yourself these four questions. So what are the health inequalities that really exist in relation to this work area? How will you work to affect health inequalities? Are there any risks that you might actually contribute to increasing health inequalities by what you do? How will you know if you've had an impact on health inequalities? And are there any other steps you need to take to make it more likely that your work will reduce inequalities or reduce discrimination? So there's really a kind of 4 important questions to have in your head. Next slide, please. So the site application guidance signposts you to the Advancing Mental Health Equity resource, and that provides detailed guidance and methods on how to reduce inequalities related to mental health support, care and treatment. And in this slide pack, I've also added the quality framework for local government, and you may find that local partners are already using that framework. We do the next slide, please. And Public Health England have also recently published their place-based approaches to reducing health inequalities, and this is to support local action to address health inequalities. And this is a resource for local systems. It's quite an extensive resource, and it aims to help local areas be more systematic in relation to how they address health inequalities. And I pulled out their screening tool C because I thought it might be particularly helpful to you. It's about service to the community. And the statements in there are useful to help you think about how you'll configure your services perhaps differently to address those inequalities. Next slide, please. And again, this is another resource from ourselves in Public Health England. We host a health equity collection, and it includes evidence, resources and guidance from Public Health England and our partners to help support national, regional and local areas to reduce health inequalities, and the links there for you to review later. Next slide, please. Next one. Hello, Rylan, can we move on? Oh, we finished. Sorry, I thought I had one more slide. So I'm just going to, thank you. Thank you. That's my contact details there. I've also added the contact details of my colleague, Susan Koffler-Schulter, and she's our regional lead for the National Child and Maternal Health Intelligence. And I had a quick conversation with her at the end of last week, and we're quite happy to for her to follow up with an additional session if you want more detail on using some of those tools. And I also wanted to flag, again, it was highlighted yesterday to me that there are some more webinars coming up on inequalities resources being led by our LKIS team on the 3rd of September and also the 1st of October. So we can also forward those details to anyone who's interested in those. And that's it from me. Thank you.
Thank you so much, Kate. That was such an informative presentation and just really helped to kind of point people in the right direction. And I think certainly for me, the new BAME slide in terms of population was really helpful. And also your list of your 4 questions, I think will be really helpful for people as they're writing their bids to consider what information they're looking at. So thank you so much for your time. Are there any questions for Kate? Please feel free to turn yourself off mute and put your video on, or else pop a question in the chat box. No questions? This is your opportunity to ask burning questions about.
There is so much there. I think people need time to go and review, don't they, and consolidate. Yeah.
It's Jenny here, Kate. Thank you so much for that. That was so helpful. I did hear in there, I think I did hear in there an offer of a further webinar to go into using the tools in a bit more detail, and I just wondered how people on the call felt about that, whether that would be useful. I don't know if we can get a sense of that by, I don't know, people putting their hands up if they think that would be something they'd find useful to have a session going into the tools in a bit more detail. Yeah, it looks like there's a fair few people that would find that helpful. So
Okay.
that we'll take that away and see if we can do that. And it would need to be pretty timely. That's the only thing with the timelines for the bid. So but Liz and I can pick that up with you afterwards, Kate.
Yeah, absolutely. We'll have a conversation with Susan. The other webinars as well, if we share those details, people might also find those useful. Appreciate they're a bit later on, so not till the 3rd of September, the first one, but just for general information anyway, in terms of, because we'll talk. We'll catch up and talk to Susan, and we'll sort something out.
Lovely, thank you.
No problem.
Thank you so much, Kate. Okay. Can we move on to the next slide, please, Ryland? So, I am pleased to say that we are on time today, which is something that Jenny and I normally struggle a little bit with. But we had allocated, it's because of Kate's fantastic presentation skills, we can't take any credit. So we have allowed up to half an hour, really to just have the opportunity to have a bit of a question and answer session. If there's any questions or queries you have about the bids, any of the information that we've presented today, either ourselves or Kate, anything you want us to take to either the national team to get answers for, this is your time. Obviously, if we don't use all the half an hour, you can leave early, and I'm sure everybody could do with cooling down, but please do take this opportunity. If you've got questions, please do either, I think we'd quite like it to be interactive, so please do take yourselves off, put your videos on.
And I see, Joseph, you've got your hand up. So is that left over from saying about the data webinar, or have you got a question for right now?
Not for now, thanks.
Oh. Okay.
I guess my question then would be to everybody to kick off is, with the information that's been provided, both in the information guidance that's been sent out and the bid template, and then the slides that you'll have from today, and also the previous detailed information from the 15th of July, do you all feel confident that you have the information you need and require in order to complete your bids? Any thoughts?
Hi Liz, I haven't got a hand to put up, but it's Jackie Beltai from
Hi,
Southern
Jackie.
Health. Hi. I just wondered if there was any, I know it's very early days, but is there any kind of data set that you're looking to start measuring against for the outcomes, or
so
something
currently
for us to develop?
We haven't been given that, and one of the things that we've asked for is from the national team, and there is a meeting tomorrow, is for if there are going to be set things that they're going to look at, can we have that now so that we can forward it to yourselves to include. Okay. But no, currently the expectation, and Jenny, please feel free to chip in if you if I miss anything or you think anything different, is it's very much about your population, so the additional women that will be seen, very similar to kind of Wave 1 and Wave 2 bids, and then also thinking about your outcome measures, both in terms of clinical and service delivery.
Lovely, thank you.
Yeah.
Hi, it's Alison Wensroll, one of the consultants over in Winchester, but we cover up by Frimley. But I'm with the COVID-19 situation, which is probably going to be ongoing. It's not going to be about minority groups, but it seems to be having a massive impact on women in terms of added trauma that in isolation. So that's probably something now we're going to have to think about in the resources that we're offering and how we're offering them.
I think that's a really good point, and I think that's something that we actually need to take back as well to the national team in terms of consideration of that, because it does add an extra layer that wouldn't have necessarily previously been there. Yeah. Anybody else who wants to comment in response to that?
No, I mean, I quite agree, Alison, and I think, you know, in some ways it's very timely, this coming along, because probably a lot of those women wouldn't have met the threshold for perinatal services, so they may well have fallen through a commissioning gap. But hopefully some of these services will be in place in time to address some of those needs. But there's not a lot of research in this area, so we don't really know the sort of numbers that we should have been seeing before COVID. So, you know, it may be that there's going to be a real high need and big numbers coming forward that need this. And then it might be about thinking about what you can do at scale. I know the psychologists in the pilot for SHIP LMS have been thinking about doing some webinars for birth trauma for women, you know, that maybe don't need EMDR or specific therapies, but might need to have a place to go and talk and discuss about their, you know, how they're feeling about it. And then from those bigger groups, they could sort of filter down and see what the need is for further therapy, but really thinking about how they might be able to do it at scale if the need is there. And I see Joseph has asked.
I was just going to pick up on Joseph's.
What support is there for teams considering putting in a bid as early implementers? So I guess what I would say about early implementers is that they are the ones that are ready to go. So I guess we would have hoped that we would have heard about those services by now that wanted to be an early implementer, because they will already have something in place, even if it's quite small. In terms of ongoing support for both early implementers and fast followers, do you have any idea about what that might look like, Joseph, and other people on the call? Because you know, we can be flexible with this. If there's if you would like to do some local sharing webinars or whatever, you know, however the network can help and support. And because it's new, I think a lot of it will be about supporting each other as well. I know the national team will put on meetings, and there will be a lot of like presentations from the early implementers themselves that fast followers can and other early implementers can learn from. So I don't know if that answers your question, because I don't know. Are you thinking about early implementing or fast follower?
Sorry, Jenny, I meant fast followers.
Okay, yeah. So in that respect, you know, if you've got ideas about what would be helpful, do tell us.
Yeah.
I don't, you know, we can do what is helpful for you guys, and whether that's sort of having forums where you can talk with other people that are going through it as well and see how they've problem solved various bits. We'll be flexible and do it according to the need. But if there's anything specific that you think, gosh, that would be really helpful, do tell us.
Okay, so we can come directly to yourself or Liz. So
what we would encourage people to do is Jenny and I are quite happy to be the first stop, if that makes sense. But likewise, if we will be kind of supporting our geographies. So we would be supporting you, Joseph, because you're under Oxford and it comes under us. But likewise, if you're in the Kent, Surrey, Sussex area, you're very welcome to come to Jenny and I, but we probably will steer you towards Anita, and Anita and ourselves will be working together to manage the whole patch, if that makes sense.
Okay.
What our proposal is, obviously we've done these couple of webinars. We will send out any additional information as and when we have it, and then what we have been doing in discussions with individual areas is if there is a need for either a workshop or a meeting that we can support and either provide information or help with facilitation, that very happy to do that. I think what I would just say is please be mindful, obviously the timescales are tight for yourselves, but likewise are also tight for us to be able to, you know, we want to be able to support you with this, but if we get a last minute request, we might be challenged to do that. So please do plan ahead so that we can also work in our support for you.
Thank you.
And I see in the chat box, Liz, Claire's got a governance question around if you're planning to test a model in one of our ICS trusts and then roll it out later. Do we need sign off from all ICS trusts?
That is a good question, and I will seek clarity for that for the national team. I think if you were able to get sign off from everybody at this stage, be it with the plan that the rollout will happen in the future, that would put you in a really good position because it's about future proposals and that. But I will double check whether you need sign off from all the trusts at this point. We will take that to the national team.
Thank you, that would be brilliant.
Yeah.
Just obviously there are 4 different trusts and 4 different governance timescales.
Yes.
So it might be a big challenge.
Yeah, and I think it might be for certain things. I think if we're aware that meetings happen at different stages, and there's quite a small window to therefore get things signed off at different windows. So I think even if you have a proposal of when things are going for sign off, even if timescales are not quite allowing, then please include that in your bid. Process is clear.
Thank you, that's great.
What else do we have when we think about bid submission? Does that mean we need to submit 1 bid for Bob? So
can I just remind everyone to mute themselves, because I think somebody's still got a microphone on, a bit of interference.
So the question for Bob, and that refers to, you know, that's applicable to other areas and footprints as well, is in an ideal world, yes, you need to provide a service that will meet the population needs of your LMS, STP, ICS footprint. But that could be done through an agreement of services, obviously working together with one service taking the lead. But yes, as said in my information, so do go back to the slides that I presented today. If you are only going to provide a service for part of your geography, you need to justify why. And the expectation is still by 2023-24 that you will roll out across the whole geography. So you need to be aiming for the whole geography. And if you're not able to do that at this stage, you need to make it clear why and what your plans are to enable coverage for the whole geography by 2023-24. Does that answer your question? Is that helpful?
So I guess at this stage, because I see you're from Oxford, Lauren. Oh, and that did answer the question. So maybe I won't. I was going to say something else then, but I'm just thinking about Buckinghamshire. Sorry. I think it's important that we can use this opportunity to do some of the scoping in areas that aren't going for early implementer, and you may well have different needs in your geography, and if you can justify that within the bid because of your knowledge of your local area, then I think that's fine. I think there will be commonalities to all the bids. And there will be some local differences depending on the population you serve. And that's what needs to come across, really. I'm doing this because, we're offering this because. And
our future plan is this.
Yeah.
So, you know, we might start off small, but we're going to roll out. But I guess the two questions that they're kind of they're looking for is, what is the plan so that by 2023-24 you will have a service across your entire geography, and what's your process of how you're going to get there. Sorry, I'm not sure. As we pointed out, that these bids are for the benefits.
Yeah, you've trailed off, Alison. You might have to talk to us instead.
Sorry. Yeah, no, I was going to say, particularly thinking of the Surrey, Hampshire sort of area in the border there, in terms of the fact that it was sort of flagged up earlier as well. It was sort of non-competitive, really, in this case. We're not trying to beat each other. No. I think, I mean, we do have workshops together for the perinatal services, and I guess really I can see that it might well work, that it's an extension from that to the three services working together rather than any one sort of the whole.
And I think that's where it's really important that these are collaborative with maternity, because if there's three different providers, maternity certainly don't want services that look very different for women. You know, if there's justifiable differences, then that's a different thing. But in the main, maternity are going to want equitable services wherever these women live, even if there are three different providers.
And Alison, just remind me, are you from the Bob area, did you say?
So I would be the Hampshire side of the food.
Oh, yeah. Okay.
Yeah, and working into Frimley, don't you?
Yeah,
certainly. Yeah. And again, this is part of our support offer. So, for example, with Frimley, where there are three different providers that I mentioned earlier. So, Jenny and I are hosting a workshop specifically for them, so they can look at their individual needs of their geography. I believe it's on the 27th of August, on the top of my head. But to look at that, so look at what is the provision currently and how can we all work together to provide a service for Frimley. So so likewise, if there are other areas, we can look to provide something similar as well. And
Lauren, you've got your hand up.
Yeah, hi, thank you. I thought it'd be easier to speak than try and type it all out. But so thinking again for Bob, and this idea that a bid needs to come in for the whole STP. If one of the areas, because I'm aware that within our area we've got wave 1 and then 2 wave 2s. If one wanted to kind of come in as an early implementer, does it mean that all need to be early implementers, or the other two who are wave 2s can follow as fast followers, or can there be that separation within it? Or
so I think, as Jenny said, what we're expecting is the early implementers. There's probably only a few that are early implementers that are really ready to go, that have services in some shape or form of existence already and are ready to accelerate them. The vast majority of services will probably be fast followers, and within those fast followers, they probably will be at slightly different stages as well.
Okay.
So the early implementers, in terms of who we are expecting to see early implementers when we went out to the original kind of shout out, is so SHIP, so the Hampshire area with Southern Health. I'm testing my brain now to check I get this right. Was Kent, and our third possible was Berkshire, but I think we kind of came to the conclusion through discussions that they're likely to be a fast follower as well.
Yeah, so put that in the chat box. So yeah, that's great in a way. If Berkshire's planning to be a fast follower, you could have so that's the three of you going for fast follower probably, which is fab. That makes it a bit more tidy, doesn't it?
The advantage of the fast follower for people is it gives you that little bit more time to, if you don't have an existing service, to scope and work up that service. The difference in kind of differentiation is the early implementers already have a service that they're going to excel. The fast followers are still kind of developing, scoping those services. Does that make it clear in terms of it is a bit?
Yeah, I think
terminology.
And I think this might be a reflection of my developing understanding, but I'm kind of hearing that a bid would have to come to represent all of the SGP, so all of Bob. So by effect, Berkshire planning to bid to be a fast follower, that makes the decision for the Bob, or does it not? Can each of the different units, so Oxfordshire, Berkshire, Buckinghamshire, therefore make their own bid? I'm understanding that we need to make one collective bid.
My interpretation, and I think we probably would need to have, it'd be worth us having a separate conversation specifically for Bob, and happy to help with a workshop or whatever if that's useful, but would be that within the plan for the fast follower, you might have Berkshire going first, and then the other areas coming on board. So you would put in one bid, but it would be oh gosh, I can't think of the word, like a staggered sort of bid in terms of implementation.
Okay. Yep.
Yeah,
I agree with Becky. I think a meeting would be really useful.
Right.
Thank you.
That's fine. We're very happy to support that. So I think what we could do with a Bob meeting is look at where you're at now. So what is on offer currently, and then what you want to do in terms of your proposal. Jenny and I'd be very happy. Please get in touch and we'll sort out, because mindful of timescales, we need to get something in the diary quickly.
Really quickly, yeah.
Yeah.
And Alison, you.
Hi, yeah, I just wanted to check, because and this isn't actually so does Portsmouth come into all of this as well, does it, or not?
So Portsmouth is included within, will be included within SHIP.
Right.
So they're going as early implementers with the SHIP bid.
Right. Okay. Because I wanted to check that, because we're already doing stuff over in Portsmouth, although I'm not involved in the bid or anything, but we've been developing stuff over there.
Yeah.
Okay. So that's fine. Okay.
Yeah. So the reason that that SHIP as a system and Southern Health as the provider is going as an early implementer is because obviously you've had the benefit of the psychology pilot that's been run in conjunction with us and the LMS for the last year. So you've almost done your scoping and pilot work during that year.
I suppose what the reason I ask is because I guess probably in a lot of services there's things going on in the background that perhaps just are sort of extra practice almost. So I know in Portsmouth that we started developing a clinic that has become more of an outreach clinic, gradually drawing people in terms of professionals as well, but I'm not even sure there's an awareness of that at the moment. So I imagine some of that may be going on elsewhere as well.
Yeah, I'm sure there's all sorts of pockets of special interest, and I'm sure there's a lot of collaborative clinics already happening between perinatal and maternity, and it's kind of building on that staff and those interests, and making sure you've integrated your specialist midwives, your specialist obstetricians, that you've thought about neonatal, and where's your IAP service going to fit into it all? Because like everything with perinatal, the pathway is complex and involves many stakeholders. So just that's why I think it's such an opportunity, because if you go for transformation funding for fast follower, you actually get a bit of time and a bit of money to look at what you need to be providing, which is such a luxury in health. The number of times we've said, I wish we had time to think about it a bit more, but we actually do with this. Yes, it's hectic trying to get the bid in on time, but you could buy yourself some project time, project lead maybe, or somebody to scope it out. So it is a great opportunity.
I was going to highlight that actually. So that was highlighted in my slides of the 15th of July. And again, it is obviously in the guidance documents that you have received, the paper documents, but within the transformation money, just to promote that also will cover additional costs which you will not need when the service is up and running. But in terms of that project management, that scoping, that service user engagement, and I think certainly from the learning that I myself have learned from the Wave 1 and the Wave 2 bids, is that people didn't always put in for those extras within their Wave 1 and Wave 2. It was very much more encouraged in Wave 2, but Wave 1 didn't, and actually, you know, take advantage of that money for somebody to help run this and scope it, and you know, because everybody is busy, so having that additional capacity is really, really beneficial, and there won't be the opportunity for that again. So please do add that in. And as I mentioned in my slides today about the additional money that you may require in terms of training of workforce and upskilling, you know, make sure that you factor all those elements in.
Yeah, and if you don't have an educator role already, you might really want to consider that, because you're going to have to re-educate your pathway to the new service and how it fits in and how it interfaces with all the other stakeholders that you've got. So there's a big old piece of work just to get the message out about these new services.
There's no mention of psychiatrists. I mean, I appreciate trauma pathways tend to be more psychology focused, but do you see there's any role for a psychiatrist within the actual process once it's happening?
Yeah, absolutely. And I think that should be acknowledged within the bid. That they definitely need to be multidisciplinary. Yeah. And I think we would ignore psychiatrists at our peril, because some of these women are going to have more complex needs, and so we need to increase that resource, I would say, within services. And Becky, you've got your hand up.
Sorry, I can't see hands up today. My Teams has changed in the last 48 hours, so apologies, I can't see anybody's hands.
Hi, thank you. I'm just from the Berkshire team. I don't want to make this a Bob issue, but for larger areas that are putting in a bid together potentially, is there flexibility and kind of scope within that proposal to make it slightly tailored for each individual area? Or is it going to be that a proposal put forward for a larger area has to be kind of similar across the board? Does that make sense?
And why would you think yours might look different? Because if it's to do with local need, then that's absolutely how it should be. You know, if you're covering a geography that looks different, then the service provision will be a bit different to meet that. So I would say that if it was under those circumstances, Becky, it'd be perfectly legit for them to look slightly different.
Okay. I would agree with Jenny. You almost want your baseline of your service that is, you know, so it's equitable across wherever you are within the patch, but then you may have additional elements which are specific to your population cohort, you know, for the individual area.
No, that's helpful. I was just thinking when it comes to kind of talking across larger areas, it might be that at some point there's a highlight that one particular area has an inequality that isn't necessarily prevalent in another area. I just wanted to make sure that it was kind of possible to be flexible if needed.
It's all about meeting that population need and reducing inequality. So if you have your baseline across and then you look at where you've got your inequalities and add on to them to bring them up, absolutely. Yeah.
You might want a therapist that speaks a particular language if the need is great in a particular area. So yeah, it's that sort of thing. Or if there's you're thinking one area might have more women who have suffered from FGM, or you know, if there's a larger refugee population or whatever it might be, that some things will look slightly different, and rightly so.
Yeah, no, that's great, thank you.
Okay, sorry, I need to swap back to questions. to go between participants. Let us have a look at diaries now. I know I myself, thank you, Lauren. I know I'm on annual leave on the 19th, so I can't do that. But let Jenny and I get in touch with you separately after this meeting, and we will sort out a date, I promise, for Bob in the next couple of weeks. In terms of, please, obviously, you've got the slides from the 15th. These slides are the latest information, but there definitely is information in those previous slides that's also relevant in terms of when we went through the spreadsheet and kind of the detail of it. But please do look at the guidance itself. These slides are a summary of the guidance, so you do need to go back and fully read the guidance and the bid template for the additional, you know, so that you've got a really full picture of what you need to do. Obviously, we have got, can I just have the next slide, please, Ryland? So the slides will be shared and we're going to have a discussion after this meeting, and hopefully we will try our best to get them out to you later today so that you have them for the meetings that you're going to in the next couple of days. The recording of the previous webinars and this one might take a little bit, you know, it normally takes a couple of days to get it up uploaded, but you'll have the slides at least. Please can I also remind everybody, if you've been forwarded the invitation, please do get in touch with us so that we can add you to the distribution list. Can I have the next slide, please? Oh, there we go. My point that I just wanted to make is obviously the next full webinar is Wednesday, the 26th of August, which is a fortnight's time when we'll be focusing on the long-term plan. What we've been trying to do is, if there are separate things that we need to fit in, such as these webinars, we've been trying to fit them in between. I know that when Jenny and I were talking about capacity and agendas and everything, we were thinking that if there was a desire or a wish for further information for this, we might possibly be able to fit one in the very first week of September, because we're mindful that you need to get these done before the 23rd. So if people feel they need further information as a whole, as opposed to individual support for your systems, then please do let us know sooner rather than later so that we can start trying to schedule that in. But do come back to us if there's specific requests for support, and we will do our best to accommodate them, and also in conjunction with working with Anita with Kent, Surrey, Sussex as well. So the offer of support is across the whole South East, obviously, and also Jenny and I will be supporting Dorset. Okay, thank you everybody for your time today. Appreciate it's a lot of information to take on board, a lot of information to go away and digest, but do come back to us if you have queries or questions. Thank you very much.
Lovely, thanks everyone. And remember, it might not feel like it, but it is an opportunity, so let's try and frame it like that and get the best for these women.